Healthcare industry is having more pressure put on it to be accountable for the decisions they're making. And however you judge that accountability, whether it's the patient's perspective, yes, it was good, or it wasn't so good, or as the insurance company who's paying for your services, it was good or was not as good. Trying to figure out exactly what does that accountability mean in terms of proof or evidence or measurement or value. What does it mean when it's good or it's better or it's the best compared to what? And trying to figure out what that is making it a very challenging proposition. First you got to agree, and then you got to measure it, and then you got to share it. And there's not always agreement.
We've been, as a practice, on clinical pathways for almost 9 years. We wanted to understand standardization, understand the cost behind care, and would be very difficult to understand that or manage that if you didn't have a standard process of care. And also, we considered it a quality metric of clinical pathway adherence. There are important evidence points that we're following national standards, that we're following national guidelines, and also helps us understand cost and how to cost a certain process of care.
Employers are engaged in value-based purchasing, and it is important to them because they are spending so much money on health care. And they have to know that they're getting value for the dollars that they're spending. But the other side of it is, are they getting quality care? Well, how is an employer to possibly know what good quality cancer care is? Well, there are guidelines, clinical pathways that if they know that the providers are doing that, that's a good indication. Is the survival rate good? Yes. Okay, well, that's a good measure.
I think oncology is one of those places where we as a payer saw a lot of variability in terms of the care that was being provided. So if you looked even within a market, as opposed to even within a state, you saw a significant variation. And so from a health plan's perspective, that's not something you really want to see. You want to see some stability, some consistency. Instead of paying for volume of services delivered, starting to move towards a pay for quality. Those are what I think are going to be the focus going forward. Aetna is a payer that has 2/3 of our customers are self-insured customers. So they're paying for this health care, and their expectation is that they're getting quality for all of the dollars that they're spending. And oncology care, cancer care, those costs are going up. I mean, drugs are driving those costs significantly, and they're looking to us to provide some assurance that we know at least that the quality is of a level that they can feel confident that all their members are getting the same level of care, it's consistent.
We are all in this whole idea of reform for healthcare and cancer care. Cancer care is on the front edge of that concept. The provider has to be in sync with the employers, with the employer health groups, with the insurance companies. The ultimate benefactor of all of this is the patient, the employee, the family. But if we're not in a line on how we view it, how we're going to recognize it, how we're going to reward and distinguish one behavior or the other, we need to keep working at it so that that patient can understand it fully in everything they're getting along the way in their entire journey. We need to remove all the barriers so the right care is delivered at the right time in the right place, and everybody's in agreement on what that right is.
The clinical pathways that we utilize are developed by physicians. I think it's really important to have a physician involvement in pathways. For physicians to decide based on clinical evidence, clinical trials, what is the appropriate process of care for a specific disease site and stage. Then looking at if there are option A and option B which are clinically equivalent, does one have a better value or costs associated with it? I think that's the appropriate way to do and develop clinical pathways.
We were looking for some way to objectively look at ensuring that the care that was being given was evidence-based. And we didn't want to be in the pathway business. So we were looking for groups that were willing to use a clinical decision support tool that provided pathways, and we would measure their adherence to those pathways. Again, providing us with the assurance that we needed that, all the care that was being provided was of an evidence base.
Our mission is to educate employers on value-based purchasing and to improve the quality and efficiency and cost-effectiveness of healthcare. The level of engagement of employers is as high as I've ever seen it right now. And the reason for that probably is because the cost of care is being so high. And for some of the conditions like cancer, those are very, very costly for the employer. It gets their attention, not just the benefits manager, it gets the CFO's attention. They're very eager and very engaged in learning about how to do it better.
I think transforming healthcare and the way that we deliver healthcare is important now because I think the dollars that are in the system are what they are today. I don't think there are extra dollars. So I think we have to get a lot smarter about how we provide healthcare, and I think about how we pay for it as well. The evidence and the pathways are critical to us to assure that we have a consistent, stable level of care that's being provided.
9 years ago when we started Pathways, and it became sort of the new norm in our practice for every patient to go on Pathways. And about a decade ago when we started reporting quality metrics inside of our practice, it was difficult. And now it is our norm.